Hi everyone, welcome back to the channel. So today we're going to be talking about one of my favorite topics, which is fluid movement, and fluid balance. So your body is made up of about 60% water, and of this total body water, you have fluid compartments which are separated by membranes. The largest compartment is your intracellular fluid, which is made up of about 2/3 of your total body water, and this is the fluid simply found within your cells. The remainder of the body water is found outside your cells, and this is called your extracellular fluid. Extracellular fluid is further divided into 3 compartments, which are your interstitial fluid, which is the fluid which surrounds the cells, intravascular fluid, which is the fluid found within blood, and transcellular fluids, which are fluids found in secretions within organs. And as you can see, they only make up about 1%, so not a whole lot. Okay, so next we're going to talk about movement of fluid. So fluid status in your body is a dynamic equilibrium. It moves between compartments by a process of osmosis and filtration. So in osmosis, only water is moving between compartments, whereas with filtration, solutes are also moving as well, both water and solutes. So osmosis is the movement of fluid across a semi-permeable membrane from an area of low concentration to high concentration. Fluid movement between extracellular fluid and intracellular fluid is directed by something called osmotic pressure. So this is the pressure needed to maintain equilibrium. The purpose of fluid moving is to equalize the concentrations of solute and osmotic pressure on either side of the membrane. Osmotic pressure is referred to as osmolarity or osmolality. The normal osmolality of our blood is between 275 and 295 milliosmoles per kilogram of water. So in normal circumstances, our osmolality of our extracellular fluid is equal to our osmolality in our intracellular fluid. So this is good to know, but what happens when we put a patient on an IV fluid or change the environment of our fluid compartments? So there's a few different kinds of fluid movements that can happen depending on the IV solution added. So first we have something called isotonic fluids. So isotonic fluids are fluids which have an equal osmolarity to blood. This results in no net movement between your fluid compartments. Your cell's going to stay the same. There's no movement. So the type of fluids are typically normal saline or Rayner's lactate. So Rayner's lactate is composed of some different electrolytes, and then normal saline is just really sodium. So theoretically, this fluid is just going to sit in your extracellular fluid. There should be no shift happening, and this is commonly used in fluid resuscitation to correct an intravascular volume deficit or to expand your blood volume. So maybe you have low blood pressure, you might give some normal saline to increase your blood volume and get your blood pressure up. Next, we have hypertonic fluids. So with these types of fluids, the osmolarity is greater in the hypertonic fluid than it is in blood. So fluid will move out of the cell, shrinking the cell to reestablish equilibrium. Here we're exposing our extracellular fluid to a very high osmolarity. So the water from inside the cell is going to try to come out to both dilute the extracellular osmolarity and raise its own to kind of establish that equilibrium. The fluid we use in this case is called hypertonic saline or 3% normal saline, and this is typically used in very small amounts to rapidly correct very low sodium water. So you can see here the water is coming out of the cell. Lastly, we have hypotonic fluids, and what this means is that the osmolarity of the fluid is less than that of blood. So we have a more dilute solution outside the cell than we do inside the cell. So the water is going to go into the cell to kind of swell it up and regain that equilibrium. example of these solutions are D5W, which is almost exclusively free water. So if you give 1 liter of D5W, you're essentially giving 1 liter of free water. D10W is a solution that actually starts hypertonic, but then when the dextrose is metabolized, it results in a hypotonic solution. So again, giving free water. We also have half normal saline and 2/3 and 1/3, which is 2/3 dextrose and 1/3 normal saline. So these are all hypotonic solutions. And these are the fluids you often use when your patient is dehydrated and you're trying to hydrate them and correct a free water deficit.